There are some new concerns for children with ADHD. In 2002, 7 million kids between the ages of 3 and 17 were diagnosed with the disorder. Now, the number has been growing since 2016, but now research says these teens are more likely to abuse drugs. And Dr. Nicole Andrioli is a psychologist and author of Mindfulness and the ADHD Parent.
Yeah, and she joins us now to talk about the new data. Thank you so much for being with us today.
Yeah, thank you so much for having me.
One of the questions was, how is ADHD and substance abuse related in teenagers?
So for teenagers, we're seeing a couple of reasons why there's such a high relationship. One is they're seeking out substances as a way to cope and to self-medicate. And this is for symptoms of things like difficulty focusing, impulsivity, hyperactivity. Impulsivity is a major symptom of ADHD, and so teenagers with ADHD have a really hard time controlling those impulses. So they're going to reach to things like substances, risk-taking behaviors, sensation-seeking behaviors at a much higher rate. Probably the biggest one, though, is the high incidence of co-occurring emotional and mental health disorders. So imagine for a minute that you're a teenager, you're struggling with problematic behaviors, controlling fidgetiness, paying attention in class, staying seated. You're hearing constant messages that you're not doing a good job, you need to be working harder. You are struggling trying to do what your peers are doing, and you're not able to match them, to match that expectation, and then you're realizing that you're really different.
Are some of the risks the same that you would see in adults with ADHD?
Absolutely. For adults too, we're looking at reaching to substances for coping, struggling to manage the impulsivity, and also co-occurring emotional and mental health struggles.
And what are the top 3 reasons children or teenagers are attracted to substance abuse?
So I think the biggest one is the co-occurring emotional and mental health disorders. So I was saying all of that becomes internalized. They internalize it as failure. They internalize it as core beliefs that are really damaging to hold on to. I'm not good enough. I'm really bad at everything. I fail at everything. That's probably the biggest. The difficulty with impulses and not thinking through consequences of choices and actions is probably the second, and then the third being coping and self-medicating.
Real quickly, before we let you go, is there anything that parents should be looking out for specifically to see if their child is at risk?
So I think, and I talk about this a lot in my book, that for parents, educating themselves on what the challenges are that face teens with ADHD, what the problematic behaviors are, what it looks like in their child is really important, and communicating that with their child, and then really being an advocate for them. They need supports in place, whether that's therapy or support groups, maybe medication. They might need educational accommodations, and it really is up to the parent to make sure those measures are in place to help keep them safe.
All right. Well, Dr. Andrioli, thank you so much for joining us today.
Thanks so much for having me.
And we'll be right back after this.